Now we'll discuss about atrial flutter. Atrial flutter is characterized by a large macro re-entry circuit, usually within the right atrium, encircling the tricuspid annulus. The atrial rate is approximately 300 per minute and is usually associated with 2:1, 3:1, or 4:1 AB block, with corresponding heart rate of 150, 100, or 75 beat per minute. Rarely in young patients, every flutter wave is conducted, producing a rate of 300 per minute and potentially hemodynamic compromise. The ECG shows sawtooth flutter waves. When there is regular 2:1 AB block, it may be difficult to identify flutter waves that are buried in QRS complexes and T waves. Atrial flutter should always be suspected when there is a narrow complex tachycardia of 150 per minute. Carotid sinus pressure or intravenous adenosine may help to establish the diagnosis by temporarily increasing the degree of AB block and revealing flutter waves. Now the management. Medical management with digoxin, beta blockers, or verapamil is often successful in controlling the ventricular rate. In many cases, however, it may be preferable to try to restore sinus rhythm by direct current cardioversion (DC cardioversion). Following cardioversion, beta blockers or amiodarone can be used to prevent recurrent episodes of atrial flutter. Class 1C antiarrhythmic drugs such as flecainide are contraindicated because there is a risk of slowing the flutter circuit, facilitating 1:1 AB nodal conduction and producing a paradoxical extreme tachycardia and hemodynamic compromise. Catheter ablation is a highly effective treatment offering a greater than 90% chance of complete cure and is the treatment of choice for patients with persistent symptoms. Anticoagulant management in patients with atrial flutter, including management around cardioversion, is identical to that of patients with atrial fibrillation. Here the ECG shows carotid sinus pressure in atrial flutter. Continuous stress. The diagnosis of atrial flutter with 2:1 block was established when carotid sinus pressure produced temporary atrioventricular block, revealing the flutter waves. Thank you, friends.